And we just want to let our media folks know that obviously the timing was a little overlapping with President Biden's discussion, but we wanted to offer this opportunity as a media avail since there wasn't one happening this week and it was a shortened week with Labor Day. And actually, as a result of today's deaths, and again, another large reporting of deaths. And as a result of that, because he made himself available, Dr. Dube did. And if anyone else has any questions, I'm seeing another one in the chat. Mike, would you like to ask this yourself, or how would you like to address that? Clarification on COVID-19 related deaths. Dr. Dube, I'll ask for him about COVID-19 related deaths. Does this include everyone who dies after testing positive for COVID, or only those deaths where COVID plays a role?
So if you note the language that we use when talking about people who die, who have died during this pandemic, we always state that died with COVID, meaning that they died and also had tested positive. What we have learned during this pandemic is that COVID-19 affects essentially every organ in the body, and it may contribute to people's deaths, even if it may not be the primary cause. It may hasten people's deaths, hence the term died with COVID.
Okay, thank you. Dr. Dube, it looks like that might be it for the questions in the chat. I know, again, we had a little bit of an overlap with the national news conference. So let's see here. I wanted to give you an opportunity to bring up the COVID-19 related deaths from today, if you'd like to speak on that.
Yeah, so I would like to speak specifically about the two deaths that have been mentioned today, and start off by expressing my sincere condolences to the families that experienced these deaths. We had an infant boy in Douglas County who tested positive on the 20th, August 20th, and died September 6th. As a parent, I can say that that is very sad. No parent should ever have to bury their child. I feel for those parents. My heart aches for those parents, and I'm very, very sorry for your loss. The second death that I would like to bring up today is a 20-year-old woman from Paul County who died earlier this month. And it's really sad when there is a loss of life at that young of an age. 20 is very, very young, and I would like to express my sincere condolences to that family as well. It's not easy for me to talk about this because I'm a parent, and I realize how heavy it is on the families that are experiencing this. So again, I want to extend and express my sincere condolences, and ask that as a state, as a people, we mourn and we grieve with you, and we offer you our prayers.
Dr. Dube, I wonder perhaps if you could speak a little bit on the increased prevalence among young adults and pediatrics in terms of just overall, young people are getting sick, and, what can you tell someone like a parent who might be, getting more and more concerned perhaps as, things are starting to open up where children are involved, just sort of all the things that we can do and the risk in our current environment.
So thank you very much for that question. What we have seen is that in the last 4 to 5 weeks, we've seen an explosion of cases in the pediatric cases. There are about a little over 38,000 cases of COVID-19 have been reported in those under the age of 18. This accounts for about 13% of all COVID-19 cases. That's a significant departure from what we've experienced so far in this pandemic, and that departure is due to due to the Delta variant. So the Delta variant is a game changer, and it implores us. It begs us to practice, to put in place all the COVID protective behaviors. What we're seeing with these pediatric cases, the highest rates are among communities of color, and specifically Pacific Islanders, American Indians, Native Alaskans, Alaska Natives, Black folks, and Hispanic folks. And these numbers are as high as 4 times those of Caucasians of similar age groups. So, and we know that this is the case because this mirrors what we've seen in the adult population. When we age adjust the data that we've collected so far in this pandemic, we've seen that Black and brown folks have bore the brunt of this pandemic. Along with this, in the pediatric population, we've seen an increase in the number of hospitalizations as well. Hospitalizations among kids are still rare. We see about 2 in 100,000 cases requiring hospitalization. And we've had 3 reported deaths linked to COVID-19 in the 18 and under 18 population. So it's a real threat, and we need to do the things that we know work to ensure that we protect those that are not vaccinated, especially 11 and under who can't be vaccinated at this time. So what are some of the things that we can do as a society? What are some of the things that families can do to ensure that they protect those that are 11 and under? Make sure that everybody in the household who's 12 and older gets vaccinated. 1. 2, avoid large crowds, because we know that the disease tends to, the virus tends to spread effectively and rather quickly in large crowds. And as we talked about earlier, the Delta variant is very, very contagious. It's more contagious than previous variants. 3, wear your mask, because we know that respiratory illnesses are spread from viral particles going from your respiratory tract to other folks. And so when you wear a mask, you prevent that from happening. And then if you're sick, if you're feeling sick, get tested, stay at home, and try to avoid engaging other folks so that you don't spread the disease. Those factors work, and they're very effective. If you're going to be outside, along with avoiding large crowds, make sure you practice good physical distancing. Make sure you practice good hand hygiene. Those things prevent you from getting COVID-19 and in turn spreading it to young kids who cannot get vaccinated at the moment.
Thank you, Dr. Dube. I see there is a follow-up question from Maggie Vespa with KGW. Go ahead, Maggie.
Hi, yeah, thanks, Erica, for your question, because it was largely answered. But doctor, if you could just elaborate on symptoms, especially in young pediatric cases, that parents should be watching for, especially in kids that are too young to speak. What should parents be looking for?
So that's a very good question. I am not a pediatrician by training. I'm an internist by training, but the presentation is very similar in young kids. So main thing to watch out for is fever, decreased activity, lethargy, fatigue, generalized weakness and malaise, runny nose, and we have to pay attention to those things, especially when little ones can't tell us that what's really going on. So the symptoms are very, very similar in the pediatric population as they are in the adult population. And of course, loss of taste and smell in those that can share that information with their loved ones.
Okay, looks like we are wrapping up. We have 1 minute to spare, and I don't see any other questions in the chat. For our media friends, again, as always, please email our OR COVID-19 media email inbox, and one of the public information officers will address that and work to get your inquiries addressed as soon as possible. And again, I want to thank you, Dr. Bukhosi Dube, for your time today. And again, if you have any other follow-up questions to our media partners, feel free to email that inbox, and we're happy to help work on them for you. So again, stay safe, everyone. And again, thanks for making the time this afternoon. I know it coincided with the national news conference, so we appreciate you being here to help answer some questions regarding today's COVID-19 related deaths. Take care, everyone. Bye-bye.
Bye-bye.